Right.
Like I think you even get a higher monthly amount.
You do. Yes, you do. Yeah.
You also get, like, if you want to try to work while you're blind, like let's say you get a job, maybe being a telephone answerer, or just let's say something you could potentially do, they can give you more leeway to make more money, what we call substantial gainful activity.
Correct. Yes.
It's higher under the blindness listings.
Right.
And that date last insured thing we talked about earlier in the beginning of the podcast, blind listings, that goes way into the future. Like 20, 25 years in the future. I don't remember exactly off the top of my head. Versus the date last insured will typically expire 5 years if you're not blind for every other disability, mental or physical, other than blindness.
5 years after you stop working. Right.
Yeah. So there's so many advantages. I mean, obviously, I would say not be blind than Social Security.
Right.
Welcome to the Evans Disability Podcast. We hope to be your definitive guide through the Social Security Administration landscape. I'm Peter Evans, your host and managing partner at Evans Disability, a law firm that handles disability cases throughout the United States. Before we dive into today's episode, I want to mention a special resource for our listeners. Click the link below to receive a free SSA disability guide from Evans Disability. This guide is packed with details on SSA disability programs, expert tips for winning your case, and sample questions from actual disability hearings. Join me as I sit down with special guests, including experienced lawyers, our extremely well-trained staff, and even a former Social Security law judge. If you find our content useful, please hit the like button and don't forget to subscribe to stay updated on our latest discussions. I hope you enjoyed today's episode. Right. And what we do often as well is we make sure to order the objective testing. So if there's carpal tunnel or I forget the name, is electrodiagnostic studies.
Yeah, EMG, NCB. Yeah.
And then we get those, and then we also will send out one of our specially designed questionnaires to the doctors to ask them about reaching and handling and being
right.
Often they can do that. Let me ask you a follow-up question to the upper extremities. Does it matter? And I, and I know you know the answer, and I know the answer. I'm asking as if I were the audience. So does it matter, if it's left or right-handed, if you're left or right-handed, and where the limitation is? Like, so for example, I'm right-handed, but if the limitation is in my left arm and I can prove occasional on that, but my right arm is fine, am I still in a good position to win, or?
Not as good for sure. Yeah. A lot of activities require bilateral dexterity. You need to be able to use both hands, for instance, assembly type work, that sort of thing. It requires two hands. So if you're only able to use one, that's going to help, but if it's the dominant one that is limiting, that's going to be much more helpful.
Right. And as a follow-up to that, just for our audience, one thing I'm reminded of, I had a case where, and this is years ago, where a claimant had both shoulders, and we had severe restrictions due to shoulders and whatnot. And she was in my office and was like, "Mr. Evans, I cannot raise my arms above my head." And she literally physically was raising her arms above. And she was still, in a lot of pain.
Yeah.
But, and then she's like, "I cannot reach in front of me."
Oh, no.
And I cannot reach behind. So there was this series of I can't do it as she's demonstrating it in front of me. And and what I tell clients is, especially because you can go in person, post-COVID now, you can go into person and have your hearing in person in front of the judge. Just be careful when you start being in front of the judge and you start to demonstrate in that way,
Right.
So if you're saying, "I cannot lift," and your doctor says, "There's no way she can lift her arms above her head," and you're like, "I can't this, and it's like,
Yeah.
but just as a friendly reminder to our audience, they will ask questions that you want to be consistent with. One of the questions they ask is, do you drive? Right?
Mm-hmm.
Because if you're saying, and your doctor's saying, he or she or the claimant can never reach in front of you.
Right.
Never. And I'm using the word never as defined in the English dictionary.
Mm-hmm.
But you're driving, that requires you to reach in front of you. Right. And everybody knows that. So that's where it gets a little bit like they ask these, and they're not trick questions, but they will ask questions at a hearing. Are you living your life consistent with all the reasons you say you can't work?
Right.
Right.
Yeah.
And that's where,
it's important.
It's important, to remember that. So sometimes, and I'm using kind of vague definitions, what I'll see is sometimes claimants will meet with their doctors and they'll go through these forms together. Mm-hmm. And it is, we should check the word never here. Be careful with that, right? Like I can never reach up. I can never reach in front. And if you convince your doctor or your doctor and you are working together on that, just remember that the English language matters. The definition of these words matter in a hearing.
Well, most judges, I think, if there's an exaggeration in one of the RFC statements from a doctor where it says never, and the judge draws a conclusion that that is unwarranted, they're going to disregard that whole opinion. And you want to be very careful. You want to make sure that you don't overstate your case, or that your doctor, in an effort to help you, doesn't overstate your case, because that'll just ruin the credibility of whatever evidence you're trying to put forward.
Right. So as we're talking about best evidence to prove it, just be careful you're not overstating. Like,
right.
You want to hit it right on the head, occasional, right? Mm-hmm. So I frequently do the dishes.
I don't believe that, Peter.
So anyway, let's move on. All right, number 5, we wrote down MS as is recognized in the regulations. If you could talk a little bit about why, how, and best evidence.
MS?
Yeah.
Multiple sclerosis?
Yes.
Yeah. I'll tell you, the interesting thing about MS is that there are relapsing remitting, they call it relapsing remitting, and generally MS, it gets worse and then it gets a little better, and then it gets worse and then it gets a little better, if you're on medication particularly. The problem with MS is that you might, let's say you go to a doctor and it's a doctor that you've been assigned to go see by Social Security, and you're having a good day and you're not having a flare of your MS symptoms. That doctor could find that you've got no impairment. And there are a couple of doctors I know who find no impairment routinely, but with MS, if you're in remission, it's hard to argue that you can't do any work. The problem with MS, however, with people that suffer from it, they're not reliable because they don't know when they're going to suffer a relapse and when the symptoms are going to come back. And, there's a whole panoply of symptoms associated with multiple sclerosis that are really debilitating symptoms. And so that's the point you want to make with the judge, I would think, with MS is, look, this is not going to be a reliable employee because look at the last 3 years. There have been 4 relapses, one relapse about every 6 months. They can't sustain competitive employment. So that makes that, I think, a reasonably successful case.
Do you see in those cases the best evidence, not just doctor reports, but MRIs of the brain and things like that are necessary as well? And that show.
Yeah. You've got to show white matter lesions on a brain MRI generally to diagnose MS.
Right.
And of course, the other symptoms, which involve mentation, ambulation, the ability to walk, hold things, just a lot of really debilitating symptoms. If they're present and there's white matter lesions, I'd say you're going to get a pretty good chance of having an MS diagnosis.
Right. So what we see is we like to make sure in our firm, we like to make sure we have those MRIs that the doctor just didn't diagnose MS. And then we have one of our specially designed questionnaires to kind of talk, what's it look like when there's, a relapse or it comes back on the symptoms, and then how long does that last, that episode?
Sure.
And then we go from there. I think too, it's interesting because you talked about MS, walking with a cane, things like that. We, as a firm, have a policy that we like to go out and we ask the claimants, hey, did you buy this cane at, your local Walmart and just bought it? And we know that you need it. We're not second guessing that. But if you did, it is helpful to get a prescription from your doctor for the cane, just so we can document that there's a doctor who said you needed it.
Right. Yeah.
So perfect. Let's move on. Number 6, we in the firm called TERI cases. And we're talking about terminal illness.
Correct.
And so this is any diagnosis from a doctor who documents you as terminally ill.
Correct.
And my understanding, there has to be like a specific timeline to it. This claimant has 6 to 12 months to live. You can't just say this, you've been diagnosed with high blood pressure and eventually this is terminal, if you don't.
That's not,
that's not what we're talking about. And I even say that, this is not to take heart of people who are diagnosed with a terminal illness, but we do get people who call into the firm and are like, aren't we, in that sort of like, I've been diagnosed with a terminal illness because I have heart disease, but the doctor's not saying you have 6 months to live. He's saying if you don't take care of this, or if you don't alter your lifestyle, or quit smoking, or quit drinking, or do whatever, you will be terminal.
But that's not a TERI case. You need a medical opinion that it's terminal, whatever disease you have, and with backup documentation. It's pretty straightforward. And if you have a TERI case, you ask for an on-the-record. You write a letter to the judge with the supporting documentation from the doctor and say, we'd like expedited review of this case. And you will get an expedited review if you've got adequate evidence.
Right.
Yeah.
And our firm does that. If a client tells us they have a terminal illness, doesn't matter what level, app, reconsideration, hearing, appeals counsel, we go order those medical records for the client. We send a letter to the doctor saying, hey, can you verify A, B, and C? And then we instantly turn it in. Requesting, and there's special rules around that, like, a TERI review.
Right.
So we talked about terminal illness, and then we put down cancer with the caveat that it affects and keeps you out of work for at least 12 months or more.
Right.
Where cancer gets a little bit tricky because Social Security is not a temporary disability program. It's, permanent, or keeps you out of work for 12 months or more, or expected you out of work for 12 months or more.
Right.
I've seen some cancer cases actually get denied because of that caveat.
Right.
But we're talking about easiest cases to win. And so I'm going to turn it over to you about the cancers, cancer in general, why you think they're the more easy cases to win.
Well, so cancer is becoming more and more curable all the time. It's not really curable, but treatment. It goes in. It's more frequently put in remission now than it was even 5 years ago. I have a sister-in-law who had stage 4 metastasized cancer, and this was a diagnosis made 3.5 years ago. She's been in complete remission for 2 years now.
Wow.
Well, thank God for that, I mean, medicine is progressing with respect to cancer treatment for sure. Two of the things that I would mention about cancer that would indicate more likelihood of a favorable decision. One is if there's been surgery, and that surgery, let's say breast cancer. Well, if you have a mastectomy, it's going to affect the muscles in your chest, your arm, your side, your ability to reach, so on and so forth. So look at the limitations, and maybe if you don't have 12 months, at least look at the existing limitations after a surgical procedure. The other thing, of course, which I always look at, is the side effects of medication. A lot of medications for cancer have very serious side effects, and you want to be sure and inquire of your client, what those side effects are that they suffer from and how they affect their ability to work.
Yeah. One of the things, too, that I look for when we're, going to a hearing or taking on a cancer case is, especially folks who've been through chemotherapy, you see the long-lasting effects. So maybe the treatment only lasted, 4 to 6 months, but there's such a long-lasting effect of how that chemotherapy just wrecked the patient's body, physically and mentally. Yeah. And if that is documented in the record,
right,
we've pushed forward. And so the 12-month rule applies to all disability cases, not just cancer cases. So for our audience, Social Security has a rule that you are out of work for 12 months or expect to be out of work for 12 months or more.
Right.
And so if you apply and you think you're going to be out of work for 12 months or more, but then in fact go back to work at 11 months and 15 days, and you successfully do that, then you're not going to be eligible for Social Security disability benefits. It has to be a full 12 months or more.
Right. Yep.
So, all right, let's move on. I know we're running out of time here a little bit. We, as number 8, said heart attacks, or specifically heart attacks. I know that a heart transplant, and as long as you're out of work afterwards, heart transplants are automatically disabled for at least 12 months afterwards. It's automatic. You're disabled if you had a heart transplant. Talk to me about heart attacks.
There are a couple of things that I've observed over the years with people who suffer from heart attacks. One is that after you have a heart attack, and there's different kinds. There's an infarction, which is considerably more serious, I think, than a blockage. A blockage, it's not unusual for someone to develop arterial blockage because of buildup of cholesterol in their arteries and veins. And then at that point, they may have congestive heart failure, or they may have an episode where they pass out. And generally, it's going to be treated with stents or bypass. And stents are kind of the best treatment. And so if a person has a stentable arterial problem and they've had stents, they should be reasonably well recovered. A myocardial infarction is a little different because it involves damage to the muscles. The heart is a muscle, basically. And if it's damaged, if in some organic way, it's going to affect the ability for the heart to continue pumping adequately. And there are number of tests they can do. One is they can estimate ejection fraction with a ECG, electrocardiogram. They can give you an idea of an ejection fraction. Ejection fraction is the strength with which the heart is ejecting blood. In other words, blood goes in, blood goes out, and gets oxygenated. And an ejection fraction is how strong that heart muscle is. And if your ejection fraction normally is going to be 55 to 60% for healthy people. If your ejection fraction is 30% or lower, you're going to be automatically eligible for disability under the cardiac listings. So that's something to look at. The other thing that I've noted with men particularly is that after a man has a heart attack, he may feel very concerned of another one, that he may have another heart attack, and it will affect him mentally. You know, I don't want to go back out there and be climbing telephone poles all day because I'm afraid I'm going to have another heart attack. And, you know, that's a reasonable fear, but whether it establishes a basis for disability or not is going to be a question for the judge to decide. And if you've got it could be an anxiety disorder. You have a diagnosis that it's an anxiety disorder and the person's getting treatment for it, therapy, maybe medication to some degree. That's going to help establish that it's a continuing problem. So that's cardiac problems can be very serious, but they're also, particularly depending on the type, they may be reasonably curable.
Right. So the ejection fraction of 30% or less, does that require, and again, I don't have the listings memorized.
Sure.
They're quite a bit. Do you remember if it requires 2 of those tests within 6 months? I think, if I remember correctly.
Well, it requires a showing of 30% or less during a period of not in crisis. In other words, you go to the ER, you're in crisis. I can't breathe. I'm having a hard time walking. Well, you're in crisis. It has to be during a period of non-crisis. And I don't recall if it's 2 within 6 months or not. It might be.
Yeah. I mean, we could easily look it up, but this podcast now is running a little bit over an hour. So I want to make sure, just, again, a reason to hire a lawyer, look up the rules, the listings. It's quite comprehensive. That's why we don't have it memorized. But yes, it requires an ejection fraction of 30% or less. Let's move on, because I really want to honor your time, and I know you're busy. Number 9 is blindness without corrective lenses. And what I mean by corrective lenses is either contact lenses, or even with contact lenses or glasses,
right?
You still are, and I think it's 20/200.
It is 20/200 is in the better eye. Okay, so you might have light only in one eye, not able to see beyond light and dark. In the other eye, it can be any degree of impairment, but in order to become statutorily, in other words, it's called statutory blindness, and you have to meet this. There are different types of blindness. There's field of vision blindness, where, you can't see your cornea or your retina isn't working well enough to see an entire field of vision. That's one type of blindness, but what we most often see is going to be the 20/200 in the better eye corrected. So if you can wear glasses and see better than 20/200 in one eye, you're not going to probably be found to be disabled on blindness. If it's worse than 20/200, it's a slam dunk.
It's interesting because on so many levels, if you do meet that 2200 criteria or worse, there's a lot of actually extra benefit from Social Security if you're found disabled under the blind listings.
Right.
Like I think you even get a higher monthly amount.
You do. Yes, you do. Yeah.
You also get, like, if you want to try to work while you're blind, like let's say you get a job, maybe being a telephone answerer, or just let's say something you could potentially do, they can give you more leeway to make more money, what we call substantial gainful activity.
Correct. Yes.
It's higher under the blindness listings.
Right.
And that date last insured thing we talked about earlier in the beginning of the podcast, under blind listings, that goes way into the future. Like 20, 25 years in the future. I don't remember exactly off the top of my head. Versus the date last insured will typically expire 5 years if you're not blind for every other disability, mental or physical blindness.
5 years after you stop working. Right. Yeah.
So there's so many advantages. I mean, obviously, I would not be blind and Social Security. Right. But so let me put that out there. But you do get extra benefit.
Correct.
If you can be found. Now, what gets hard, we may still win a case, right? Because the person does not meet the 20/200 rule, but their vision causes them to have headaches, and their vision is so bad, it's not that bad, but their vision does cause them to be, what's the right word? Like clumsy in a sense. They can't walk very well, and they can't, limits them to that sedentary job. Now they can't see the screen, they're not 20/200. Right. But they still have issues. Yeah. But they don't get the blind benefit. They get the I got headaches benefit, right? I got dizzy spells benefits. I have stumbling issues. So it is you can still potentially win. What we're saying is 20/200, best corrected by, you're going to win like that. Yeah. Okay. Best evidence on that is obviously optometrists coming in saying, here's the evidence. All right. We're there. Finally, number 10. We wrote down stroke with lack of use of one upper and lower extremity. So someone has a stroke, and maybe you can deep dive into that a little bit.
Okay, it's pretty straightforward. Well, with a stroke, you're going to have one hemisphere affected more than the other. So in other words, I think usually it's the left side that is affected. So let's say you have a severe CVA and you're not really able to use your left arm or your left hand, and you've got a heck of a limp because your left leg is also affected. So you have to use a cane with your right hand. That's pretty much going to knock out all jobs. I mean, if you can't use one of your upper extremities and one of your lower extremities, there is actually a listing that talks about that, and it's going to increase the likelihood of a favorable decision. Right. Pretty significantly.
And I think the theme in all of these, these are good cases in our top 10 list that we've gone through, in cases that are easier to win. And again, we're not saying that it's an automatic, because every decision is different. But make sure to get it documented, by the appropriate objective testing, meaning MRIs, X-rays, scans, and have your doctor on board with what all of this means as far as limitations, like your ability to sit, stand, walk, and lift, Right. And arguably, if you have a judge, and you'll know who your judge is, their name's on the paperwork when you're at the hearing level, is that if you have and you can actually Google the name of your judge, and there's different websites that will show the percentage rate of pay. If your judge is a low-paying judge, you may want to make sure you get opinions from every doctor and see all the right specialists. So you're not going to, you're not going to want your medical doctor to diagnose you with severe depression and anxiety and fill out a depression, one of our psychological forms or mental health forms, you're going to want someone who actually specializes in mental health to do that, right? Because that judge will discredit your primary care physician as not being able to be a or not be an expert, I guess, in that, for lack of a better word, in that, mental health. So, yeah. Well, listen, we finally made it through the top 10 list. I really, really appreciate your time.
Oh, you bet, Pete.
Your
insight. Enjoy this. Yeah.
Yeah. Okay. I hope to see you soon.